Dr. Rachel Knox. I'm co-founder of the American Cannabinoid Clinics, founded right here in Portland, Oregon. The challenge, I believe, for medical doctors or healthcare practitioners in general today, amidst cannabis legalization, is legalization that preceded medical education. You know, we doctors are supposed to be experts in physiology and pathophysiology or illness and disease, and know a thing or two about the pharmacology of things. But we were trained according to pharmaceutical drug science and not botanical science. So we are really at a loss to how to counsel patients and consumers who inevitably become patients these days on using cannabis in general. Like, we really don't have a clue where to begin. And I think there are a lot of resources out there for healthcare practitioners. We have continuing education programs. I mean, there's still Leafly and there's Green Flower Media, but at the end of the day, we're not learning the true physiology. Again, we started in medical school learning about the anatomy, how the body worked. Well, the endocannabinoid system, which was uncovered between 88 and 1992, still isn't taught. Right? I graduated medical school in 2012, didn't learn a thing about this physiologic system that controls everything else. And without that really sound or fundamental understanding of the physiology, it gets really hard to figure out how to, even with our best intention, to help patients use cannabis. So I think for me, the solution is teaching healthcare providers about the endocannabinoid system, about its function and its dysfunction, and how to use tools like cannabis, which is a treasure trove of phytochemicals, how to use cannabis and other tools to modulate that system to get people back into health. There are a lot of resources for patients, just like there are a lot of resources for healthcare providers. And I mentioned a couple very, very common resources, and I didn't mention Project CBD before, but Project CBD, Green Flower, Leafly. I mean, there's a lot of more popular culture sites that I do think patients can go to for good, well-supported information, and by that I mean supported by peer-reviewed evidence, peer-reviewed studies and research. Making sense of it is the challenging part. With all the information, at the end of the day, if you still don't know what is the best product for your specific condition, you're still gonna feel out of the loop. Now, I'm a cannabinoid medicine specialist or an endocannabinologist, so it is my job to make sense of the best of the science and how we can apply that to the physiology of disease. And there aren't a whole lot of people like me and my family out there. You can find us. We're the American Cannabinoid Clinics. You could just Google that or Google Dr. Knox and you'll find us. And we are an open door. We love helping patients. But at the end of the day, we really need to get in touch with science, which is showing us that we can get super precise with cannabis. And what I love about cannabis is that for a long time, people have been able to just grow the plant and sort of use it as though they're throwing it on the wall and hoping it landed somewhere near the bullseye. I mean, cannabis has such a broad safety profile and is so pharmacologically active. It's no surprise that people get a degree of benefit when they use it. But what science is showing us is that we can get even more precise. We are getting so much more precise in applying certain chemical profiles, so what we like to call strains. We call them chemical varieties or chemovars. Applying chemical varieties or full spectrum products to specific conditions based on the needs of that condition at the cellular level. What we're learning about the endocannabinoid system and other receptor systems in the body is that we can modulate that system by matching the right phytochemicals, the right phytocannabinoids, the right terpenes, the right flavonoids to a condition to get good results. And unfortunately, that information isn't out there just yet, which is why if you're not getting good results with your cannabis medicine, then absolutely seek out a cannabinoid or a cannabinoid medicine specialist or an endocannabinologist. At the highest level, a lack of cannabis competency and a lack of cannabis cultural competency remains a barrier for patients. We've been legal medically in Oregon since '98, and I think patients are still struggling with misconceptions and biases and prejudices coming out of doctors' offices and our hospital systems. People are still getting, child protective services called on them because they're offering their kids cannabis who have been approved for a medical card. Folks are still getting their medicine taken away from them, when they get admitted to the hospital. So I think from a cultural and a social standpoint, we still have a very long way to go. I think for medical patients in this state, the legalization of adult use has kind of created sort of a hairy situation for patients, and we're trying to get to the bottom of that. I serve the Oregon Cannabis Commission, and one of our tasks is to develop a new framework for the Oregon Medical Marijuana Program so that it does make sense for patients yet again. But I do think that adult use being legal here in Oregon, it has, to a degree, maybe lessened the stigma, but we still have a long ways to go, I think, to normalizing even for the acceptance of patient use. I think dispensaries and dispensary attendants or bud tenders are doing the best they can. I do. I think here in Portland specifically, and really Oregon, the whole state over, the intention is to provide high quality service and products to the patient or the consumer. So I won't begrudge anybody of their intention and their efforts. However, if you do not have a background in medicine or health, if you don't understand physiology, you are setting yourself up for liability. I can get malpractice insurance. A bud tender cannot, right? And so that is the liability of giving medical advice at a dispensary. I would hate to see anything happen. I haven't heard to date that anybody has sued a dispensary or a bud tender for giving advice that led to insult or injury, and I hope that day never comes. But at the end of the day, anecdote is anecdote, and what worked for you may not work for somebody else, and it's not because it's anecdote. I'm one of those believers in anecdote, right? In the clinic, we call it the N of 1. I don't care what randomized controlled trial suggested that this drug is best for the general population. If it doesn't work for that one patient, that's what matters to that one patient. And it's no different with cannabis, but cannabis, being a treasure trove, still works better in some people and not as well in others, and that's because of the endocannabinoid system. All of our endocannabinoid systems are in different places. They're in different states. They're in different ranges of flux. We have different needs. So when it comes to really helping patients get precision in their outcome, it's going to take a much more savvier person who is familiar with pharmacology, who's familiar with physiology, to help make the right decision with that patient at the dispensary shop.